On the email or on the?
On the.
Oh, okay.
Yep.
Cool.
I'm Jocelyn, by the way.
John Manson.
Nice to meet you.
Oh, good.
Just hang it around.
I'm Jocelyn, by the way. Nice to meet you.
Good look, Dave. With a glove here.
Good morning. Today represents 7 years of pioneering work on behalf of several key individuals, most of which are here this morning. I am honored to introduce to you and the state of Florida, the Florida Health Data Network, or the FHDN. The FHDN is a Health Information Exchange, or HIE Network, developed and solely funded by HIE Networks, based here in Tallahassee, Florida. This new network can connect disparate electronic medical record systems of hospitals, physicians, laboratories, pharmacies, and insurers without geographic boundaries in Florida or the nation, and facilitate sharing patient clinical records in a single unified view between authorized providers in a secure and real-time manner. Privacy of patient records is a fundamental element of providers and any health information exchange. Robust health information exchange actually improves patient privacy by reducing unauthorized access to patient data compared to the existing paper environment. With current HIE technology, we can prevent records from being faxed or released to the wrong recipients and know exactly when and who accessed a patient's record. As a unifier, integrator, and consolidator of local providers and HIE organizations, HIE networks can easily facilitate exchange statewide and nationally. We can connect any provider or organization to share information across these communities, regions, and the nation. The Florida Health Data Network currently has records for nearly 1 million unique Florida patients and has processed more than 32 million clinical records and responded to more than 8,000 user queries of the system. HIE Networks and the FHDN are the result of my partnership with Dr. Dan Kalin. He and I began the Big Bend Regional Healthcare Information Organization in January of 2005 here in Tallahassee, which was profiled in a recent report as one of the 12 successful leaders in emerging digital integration of medical records by the National eHealth Collaborative. I would now like to introduce you to my friend and partner, Dr. Kalin. Dr. Kalin is a practicing vascular surgeon here in Tallahassee and the current president of the Florida Vascular Society. Dr. Kalin.
Thank you, Alan. The Florida Health Data Network provides for the efficient electronic distribution of demographic and clinical data and was without question the infrastructure required for true healthcare reform. HIE Networks has been exchanging demographic and clinical data for the provision of care since 2007. A unique aspect of this network is that it is community-based, local provider-driven, and compatible with other networks and groups. This local provider-driven model has proven to be sustainable and proven to be the true method by which health information exchange should be performed. By exchanging clinical records and demographic information in a robust HIE network, physicians can eradicate inefficiencies, eliminate duplicative services, and clearly reduce medical errors. The benefits to the citizens of Florida and the country will be realized in lower healthcare costs and the ultimate goal of appropriate use of best practice standards for patient quality care. This can and is being accomplished through the secure HIPAA-compliant network that maintains patient privacy, but at the same time allows credentialed providers to access the clinical data they need for decisions. Through our efforts across the state and with our partners, we have proven the benefits of local provider-driven health information exchange. As the only endorsed HIE vendor for the Florida Hospital Association and the Florida Medical Association, HIE Networks through the Florida Health Data Network will help provide a trusted roadmap and pathway for providers to provide true health information exchange in the state of Florida and beyond. At this time, I would like to introduce Kathy Holzer, Vice President of Health Policy and Advocacy for the Florida Hospital Association, and thank their association for their dedicated work to this very important effort. Kathy.
Good morning. Thank you all for being here today. FHA is really honored to have this opportunity to work and collaborate with the Florida Medical Association and with HIE Networks to improve patient care all across the state, all across this country, ultimately. Health information exchange is the most transformational tool we may see in our lifetime. It has so much potential to both improve cost, effectiveness, and efficiency, but most importantly, to save lives. And it is a true example of how physicians and other clinicians working together, focused on their patients, have made a difference. I'm not going to tell you all the benefits to a hospital for health information exchange. I'm going to ask you to be the health information exchange for your community, for the dedicated nurses and physicians in this state, and for the patients. Tell the story of how a group of providers gave up their family time, their weekends, to sit together and define and develop a tool that can truly transform how we deliver health care. Those same dedicated individuals every day dedicate their lives to treating you as their patients. At no time in healthcare have we faced more challenges. We are looking at significant cuts in Medicare reimbursement at a federal level, and we continue to receive cuts in the Medicaid program. Governor Scott's recommendations for the 2012 budget include a $2 billion cut to hospitals. And most people see a hospital as a building. Well, the hospital is the community. The employees, the nurses, the other clinical staff, the physicians, all are part of your community. And most importantly, the patients are their family and your family. A $2 billion cut to hospitals will mean jobs lost, will mean services reduced, will mean some hospitals close. That endangers lives, and it endangers efforts such as health information exchange. Please be the health information exchange during this coming legislative session for the doctors and the nurses who serve you, and for the patients who are your family members and your neighbors. Tell the positive stories. Tell the story of HIE Networks and how, without any federal or state mandate, way before anybody thought about funding anything like this, a group of dedicated doctors, other clinicians, Mr. Byington, who's an entrepreneur, got together and gave up their weekends, their family time, to do what was right for their patients. please tell that positive story. But please also talk about health care, talk about what the cuts to hospitals, the cuts in programs mean to you, your neighbors, and to those people who provide you care on a moment's notice. They're always there. It doesn't matter if it's a holiday, it doesn't matter if it's a weekend. Be their health care caregiver. Tell their story. I'm going to introduce Dr. Chris Pittman. It's a real honor to have the opportunity to work with the Florida Medical Association. Dr. Pittman is a practicing physician. He is also chair of the FMA Health Information Technology Committee, and he has been a tireless champion for improving patient safety by leveraging health information exchange.
Thank you, Kathy. Today's announcement marks the consummation of a 3-year journey begun by visionary members of the Florida Medical Association. Maintaining physicians as the guardians of our patients' private health information is of extreme importance to both physicians and patients and a vital part of the sacred physician-patient relationship. The Florida Medical Association is committed to a statewide health information exchange solution that preserves physician stewardship of our patients' confidential health information. Physicians are rapidly shifting from paper charts to electronic medical records, and our patients' health information is increasingly being transmitted electronically within newly developing health information exchanges, referred to as HIE. HIE is comparable to the internet, where medical records are securely transmitted among authorized healthcare providers. Electronic medical record systems, referred to as EMR, are comparable to personal computers, where physicians electronically gather and use patient records in their offices and clinics to provide optimal health care to our patients. In the coming years, individual private health information will be available to authorized physicians at the point of care with a simple click of a button on the medical records internet. Electronic medical records and health information exchange can improve our lives, just as personal computers and the internet have improved our lives over the last 20 years. However, confidential health information that is available over the medical records internet raises legitimate security, privacy, and quality health care concerns. For generations, physicians have been trusted with the medical records of our patients. Physician oversight of physician-generated medical records is and always has been fundamental to the physician-patient relationship. And the Florida Health Data Network model ensures that physicians maintain this oversight. There is a growing custody battle over medical records that patients and physicians have never faced before as a result of developing health information exchange networks.